Hi, and welcome back on the Senior Network. We are now joined by Tatiana Zanzig, PruittHealth at Home.
Good morning.
Good to see you again.
Good to see you as well.
Well, I heard you in the hallway mention something about American Heart Month, and that is February, right?
That's right. Yep, the month of February, American Heart Month. It's something that we felt it would be appropriate to discuss just because so many people are impacted by, heart disease and.
Yeah. Now, are you guys, anything special going on around that with you in Pruitt at all? Or are y'all just concentrating? Is there any additional training or seminars or things you guys are putting on?
Well, we actually do have care kits that are specialized to tailor to our patients that have heart issues,
right?
Or that have, hypertension or even that are at risk for heart issues.
Sure.
So we kind of make sure that we always individualize our education to our patients, but of course, during the month of February, it's even more so on our radar. So.
And you're right. I mean, I think through the pandemic and everything we've been dealing with, I think probably people have taken other issues for granted maybe a little bit because we're so worried about the pandemic and COVID and the heart issues they've always been there. They never went away.
Right. They never went away. And even more so, we have to be a little more careful and conscious of that, of who's at risk and paying attention to the warning signs. And
what are some of the warning signs?
Well, heart disease is kind of like a broad, it covers a wide range of diagnoses.
Sure.
But basically, any kind of chest discomfort, maybe feeling like your heart is racing, having a fast heart rate or a slow heart rate, shortness of breath, severe fatigue, especially if you were once able to climb a flight of steps and then all of a sudden you can't climb a flight of steps. Things like that you really want to watch out for. Which is why it's, again, so important to make sure that you establish care with a primary care doctor. And if they feel that additional testing is necessary, they can draw blood work, they can, take a look and listen to you and possibly refer you to a cardiologist if necessary.
Exactly. And you brought up a great point. I know because people have been afraid to get out, that I know talking to some physicians in the area that a lot of folks are not making their follow-up appointments.
That is something that we have definitely really been trying to educate our patients, making sure that they maintain those appointments. And however they may look, I mean, even if it's a telemedicine appointment where there's a video component so that the provider can actually still assess the patient, kind of look at their breathing, kind of see how they're presenting and make decisions moving forward with their healthcare based on that.
Actually. And I know, Tatiana, you probably work with a lot of primary care physicians.
Absolutely.
Yeah. And you guys, I know your patients go back and forth and home health and hospitals and things like that. How is it your relationship and your role? Is it mainly the nursing clinical staff that's working with the physicians, or do you actually get involved with that?
I actually do have a pretty, I'm pretty involved with, at least at the beginning, making sure that there are no gaps in communication, making sure that when someone is referred to home health, that the transition is streamlined and that things aren't missed. It's really easy, especially now, for communication to become fragmented between the different providers and the different specialties. So it's part of my role to make sure that all of that comes together. And, it really helps promote positive patient outcomes, and it really helps our patients and families feel more comfortable in the care that they're receiving.
Exactly. Well, for the viewers that don't know, Tatiana, give us an idea, what's that process look like to start care with Pruitt?
Well, so sometimes it's as simple as a phone call.
Okay.
We've actually had quite a few patients in the past and even recently reach out to us and say, hey, we found you online. We saw that you had such an amazing Medicare rating. We think that, our loved one may be a candidate.
Okay.
And so basically what we would need is to make sure that the individual has a primary care doctor. And if they don't, we can assist with that.
Okay.
But that's ultimately what it comes down to, is we need a provider to be able to order home health, and then we can go in, evaluate, and see if someone truly qualifies. And if they do, a clinician can come to the home, of course, wearing full PPE, and we're tested weekly, so we make sure that we don't contribute to the spread of the virus. But the clinician would come in, depending on the patient's needs, a couple times a week, or whatever's really needed, and whatever CMS will allow.
Yeah. And I understand, and I know you work a lot with the hospitals, and a lot of folks coming out of the hospital really do need home health.
They do, yeah. They really do. I mean, even if it's just, home health is not a long-term option. It's supposed to be intermittent and short-term, and it's, again, just supposed to help with smoothing that transition and maintaining that, opening the line of really communication between the hospital, the primary, the family.
And the great news for our senior population is most of the services are covered, correct? Medicare.
Yes, yeah. Usually, Medicare covers home health 100%.
100%, okay.
Yeah. So as long as we're following a treatment plan that, that really makes sense and that's tailored to the individual, then there really should be no issues at all.
Great. Awesome. Always great information from you. I appreciate it, Tatiana. Thank you for joining us today.
Thank you for having me.
Stay with us. More to come here on the Senior Network.